So I've been a long-term patient of Dr. Rucker's under TRT and a number of other different things from different injuries. But one of the biggest questions I think people have when they talk to me and the conversation gets going is, how young is too young to start on testosterone replacement therapy? And I think there's a proper answer to that is built in logic and proper medical application. So that's my first question to you. How young is too young? How old is too old? Why is there ranges? And why do you see that there's a massive drop in testosterone production in males over the last decade? We see it in the literature all over the place.
Those are great questions posed by Dr. Regan. By way of background, I am originally trained as a urologic surgeon. So I was board certified in urology, and these are questions we would debate. I'm going to start off by saying I don't think science, modern medical science, has a perfect right answer, but I'm going to give you some theories. I know Dr. Regan's going to have some theories, so I'm going to ask him to add in, because no one has a perfect answer. From my standpoint, over time, I do believe that a lot of toxins in the environment are changing the hormonal structure and status in our population. And as a urologist, we have proof of that because of the incidence of certain birth defects that are hormonally related, such as something called hypospadias, which is the position of the urethra on a newborn male. That's an example. We've seen an increase in hypospadias. We've also seen increase in male infertility rates. So what is my answer? I don't have any age cutoff to provide excellent medical care. So when we are providing hormonal management, we're providing excellent, detailed, customer-specific or patient-specific medical care. We are providing detailed, patient-specific medical care when it comes to testosterone management. So you might meet patients that are 21, 23, 25, and they have low testosterone. Now, one of your parts of your question is the range goes 240, for instance, all the way to 1100. So if I meet a patient who's 22 and his level is 250, 310, and he's filled out the questionnaire about being low in testosterone, I'm going to be aggressive about his testosterone management, because a range from 250 to 1100, a younger patient should be a lot higher naturally on that range, probably in the 600 to 900 range. So back to the why, I've seen patients have history of head injury. I've seen a lot of firefighters and police officers who are in their 30s, maybe late 20s, and it makes me wonder if the flame retardants in their clothing. There could be various reasons. So in summary, I think it's proper medical management to do the questionnaires on younger patients and really be sensitive to their needs, because modern medicine is not cutting the mustard when it comes to that. They are just adhering to routine abstract testosterone ranges in the 350 to 1100 range, and if the patient's low normal, they're not paying any attention to their needs.
So my next question is, it sort of bounces between the cultural phenomenon that we see, which is weight gain, man boobs, okay, so gynecomastia, that is naturally occurring in younger adults, younger adult males, 19, 20, 22 years old. This shouldn't be happening. When I grew up, we never saw these kinds of weight gains and these kinds of problems. So how do you match sort of the change in the environmental phenotype, the way people are expressing themselves versus the
Like
old school kind of
what
idea
their natural state should be.
What their natural state should be at a 20-year-old.
Right. And I think there's a large impact regarding poor nutrition and poor habits when it comes to that. Number one, these 20-year-olds who are on poor diets and they're developing a sedentary lifestyle, the extra fat that's adhering to their tissue, fat converts testosterone to estrogen. So if you have a lot of estrogen floating around the body, you're going to already have a tendency to form gynecomastia, as you were mentioning. Also, there's some there's some concepts that whether it's xenoestrogen, xeno means foreign, maybe there's a xenoestrogen impact because they're putting too many hormones in the food supply. These are things that will get you branded a conspiracy theorist, but it looks like the data is there. We're seeing more of this, like I described the hypospadias and infertility. We can't discount the fact that these are real things. So the reason is due to poor nutrition, due to toxins. If you get a combination of lower natural testosterone and increased estrogen, you're going to start seeing the feminization of men. So that's what I think is happening.
Yeah, so I think that's exactly what's happening. We're seeing the feminization of men due to environmental overloads of toxins, whether it's through diet or through exposure through volatile organic compounds in the air or in and around their workplace. They are suffering and getting an increase in their estrogen levels, and the more fat they gain, the more what they gain, the more estrogen they gain. So they become a harder and harder patient to try to slow down. It seems like a freight train that takes off. Is that about right?
Oh yeah, 100%. I don't have anything to add to that. I think it was accurate. And the final thing I'll tell you is we are sensitive to the needs of patients that are younger. I think that's something that sets us apart because we're paying attention. We care. We both have sons and we have younger friends. So give us a call. We'd be happy to address your concerns.